Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker. Very glad to be joining you today, and we're thankful that you are joining us. So thank you for tuning in. We appreciate it. We always like to go and get information and education wherever we can. One of the best ways to do that is with Earl Eues, Director of Emergency Preparedness for the Office of Homeland Security for Terrebonne Parish. Earl, welcome back to the program, my friend.
Hey, Keith, it's good to be back.
Thank you, man. I appreciate it. So it seems like we're dodging weather, we're dodging cases, we're staying away from people, and we're being impacted by COVID in a way that we didn't expect at this time of year. Tell us a little bit about what you guys are seeing and hearing over at your department.
Well, we're seeing an increase of cases, like, everybody's, if you've been watching numbers, you've been seeing that. Just this week alone, like Monday through today, we had 1,054 cases. Last week, we had a little over 800 cases. So we are still seeing an uptake in the number of cases of COVID. HTV has had a couple of doctors on, and just recently you had Dr. Ben Adams and Phyllis Peoples, the CEO of the Terrebonne General Health Systems, talking about the conditions at the hospital, what's happening in those areas. And the hospital has been getting very busy. The emergency room is busy. So I just can't stress enough that people need to go out and get vaccinated to help us control the uptick that we've had of the coronavirus in our community. And so I was looking today, across the state of Louisiana, there's 2,500 facilities or drugstores, those types of businesses that the vaccine's available. So if you need a vaccine, it's available. You need to go find one.
Yeah, it's just it's quite easy to get a vaccination, and the numbers are still very glaring. It's really interesting. We talk about how life is very often inconsistent. Well, the consistency with what we're seeing and hearing out of the hospital systems, like you mentioned, Terrebonne General Health System being one of those, but we're seeing that in cases from July 29th through August 4th, unvaccinated COVID patients account for 90% of COVID cases and 83% of COVID deaths. Unvaccinated COVID patients make up 91% of our current COVID hospitalizations as of today.
I heard a statistic yesterday of the children that are in the hospital, like a children's hospital in New Orleans. 90% of those children's parents, 98% of those children's parents are not vaccinated.
Wow.
98%. That's an alarming number.
I got to tell you, I'm almost rarely speechless, but I'm somewhat speechless as to how people can determine that it doesn't make sense to be vaccinated. I'm rather speechless about it.
Well, and look, everybody has, and I'm trying to figure out a number, everybody has, their reasons for not getting vaccinated, but one of the things I've been saying all along is what part of 90% unvaccinated is in the hospital and only 10% is vaccinated. What part of that you do not understand? The easiest way to put it is, if I had 100 people in the hospital, 90 of those do not have or not vaccinated. That's 90%. 91. Okay.
91.
91%. Okay. 91. 9 people in the hospital are there because, they're vaccinated, but they're in the hospital. But your odds are much greater if you're vaccinated, you won't end up at the hospital.
Right.
An alarming, I'm going to give you
dying.
Huh?
And not dying.
And not dying. They're in there getting treatment and they're getting released.
Right. And they're getting better faster, and their lungs aren't impacted nearly as much. And these are the words of Dr. Nathan Sutton, the Director of Emergency Medicine, Director of Internal Medicine over at Terrebonne General Hospital, as you mentioned. They're just not as sick. He said, that's just that's the way it is. They're just not nearly as sick, and they go home sooner. I didn't mean to interrupt you, Earl.
That's okay. Since August 1st, we've had 13 deaths from COVID. Okay.
Mm-hmm.
it's almost one a day. Today's the 12th. It's a little more than, if you did the average, it's a little more than one a day. But we haven't had those numbers since the beginning of this back in March of 2020. When we were having a lot of incidences in the nursing home, with the older population that also had other comorbidities. So it's very scary. We're hearing more and more reports from doctors that people that have other conditions aren't getting the treatment that they need because there's no room, at different hospitals. We're having a hard time transferring patients that need other care that we don't provide in our area that is provided in other areas, and trying to transfer those patients to the other areas. This is becoming a serious medical issue within our community, and we need people to go get vaccinated.
One of those things that we've been talking about is the volume and the impact of these COVID cases, especially this Delta variant. And one of those things is the Delta word is a difficult word, but the word divert or diversion is an even more difficult word, because that's what we're being told from some of these hospital systems, that they are starting to get overflowed and rather overwhelmed with so many of these COVID cases that they can't really treat a lot of the other conditions that they would like to.
Yeah, and that's true, Keith. But I do want to remind our viewers that if you aren't feeling well and you think you need to go to the emergency room, please go to the emergency room. If you think you're having a heart attack or a stroke or some other major emergency, you need to go to the emergency room and get treatment. Don't let people saying that the hospitals are full and you can't get in the emergency room and all that. If you have a dire emergency, please contact 911 and get to the emergency room if you need to.
Right, and so one of the things we want to do is we want to, in the community, make sure that we're doing what we can. We've been told the best way to do that is one of the 3 vaccinations, so that you can protect yourself from getting seriously ill from COVID. We're not going to say that you're not going to get COVID, you're not going to get the Delta variant, but what the professionals are telling us is that it'll protect you from getting severely ill and protect you potentially from dying from that. And so that's what we can do in the community. But if you're sick and ill, you need to be able to go to the hospital, and they're going to find a way to help you. Go ahead, Earl.
That is correct, Keith. And the other thing is if you just need a test, like a COVID test, because you think you might have some of the symptoms of COVID, please contact your family physician and get him to prescribe you to get a test. And then once he gets the results back, he can evaluate you on if you need further treatment or if you need to be admitted in the hospital. So if you need a test, please contact your local physician and not go to the emergency room just for a test.
Right. You only want to go to the emergency room for an emergency, or go to the hospital as your doctor directs it.
That's
you kind of
correct.
want to go through your physician. Now, speaking of things being directed, we seem to be directed here by a lot of activity in the tropics again, and really starting to experience another situation with a tropical system. Let's talk a little bit about what you know about that and what we need to be prepared for.
So at the present time, we have Tropical Depression Fred, which is, once it leaves the coast of Cuba, it'll probably develop back into a tropical storm, Fred. But it looks like it's going into the Apalachicola area of Florida this weekend. So it's not so much of an effect on us, but it will affect the Florida coastline. But immediately after that, we're looking at something else that's in the Atlantic that has a 40 to 50% chance of development over the next few days. So we're keeping an eye on the tropics. They're getting busy. This is our busy time of the year. I think September the 12th or September the 14th is the peak of the hurricane season. So we're on that upstroke of the peak during hurricane season. And even though this storm is not affecting us, now is a good time to look at your plan. Where are you going to go if we ask you to evacuate? What does your to-go kit look like? Go through your supplies, make sure everything's working and is up to date.
Yeah, and that's one of those things that we get a snapshot earlier than we ever have about the potential for some of these storms developing. And so you and some of the girls from New Orleans have really been helpful in letting us know in the National Hurricane Center about what we can be prepared for. And getting that information ahead of time. We're much better prepared than we used to be.
Yeah, Keith, we are, and the National Weather Service, National Hurricane Center does a great job. Now with the better technology out there, newer satellites, they can see these storms forming further off in the Atlantic and make decisions on what kind of development they're going to have. But I want to just let everybody know that in the event that we have a major hurricane coming towards Terrebonne Parish, and if we have to call a mandatory evacuation, we will provide transportation for everyone that needs to go up to our point-to-point shelter in Monroe. And we are going to do what we can to do social distancing at that facility. It is a large enough facility that we think we can provide the social distancing. But as an extra factor, if you were vaccinated and we had to evacuate you, you have less of a chance of contracting the coronavirus at a shelter if you were previously vaccinated. So, people that aren't vaccinated and they rely on us for transportation and sheltering during a major storm, I please encourage you to go get vaccinated.
Yeah, and it's just one of those things. This is where COVID meets hurricane season. And we just need to be aware of that. It's one of the things that some people may not consider. I mean, I know somebody that went and got their vaccination when they realized they needed to fly to go somewhere else, to go to a family wedding. They're like, oh, never really thought about that, but I should probably get my vaccination. And again, it's a really good point, Earl, that if people are going to require help and transportation for us to go, like you said, from point to point, we want to make sure that everybody stays as healthy as possible. And if somebody is potentially unvaccinated and has COVID, there's a higher risk of that spreading.
That's correct, Keith. And look, I applaud those that have went out the last couple of weeks and gotten vaccinations for COVID. From last Thursday to this Thursday, we had an increase of about 3,000 people that went and initiated their vaccinations or completed their vaccination. So I applaud those people. I thank you for going out and doing that. But in order for us to protect our community like it needs to be, we need 5,000 people a day to go get vaccinations, not 3,000 a week.
5,000 a day. That's our shout out. Earl, we appreciate your time as always. Thanks so much.
Thank you, Keith. Have a great week.
All right, and that's Earl Eues joining us. We appreciate his direction and his time. All right, don't go anywhere. More Bayou time when we continue.